Hi, it's Dr. Centeno, and we're going to talk today about how too little or too much curve may be causing back pain and about balancing the psoas and the quadratus lumborum. Now, you see two different pictures here of that iliopsoas or psoas muscle, and I'm going to outline here what you're looking at because this might be a little confusing for you to see, but down here on the left picture, you can see it starts up in the spine and ends up in the hip. And on this picture on the right, again, it starts up in the spine and ends up here. We can see a different picture. So basically, it's the muscle that connects the spine to the hip. And this actually starts up in the ribs here. It connects into the spine, but it also connects down to the ilium. And we can see that same picture here, it connecting all of those different spots. So it connects the spine to the ilium, basically, or the ribs to the ilium. Now, this picture off to the left is going to look like mush to you, but it's actually that picture. It's a slice, a sideways slice through the spine. And we're seeing some things here I want to identify. This is a transverse process here, and there's another one here. So this is this transverse process here, and this is this transverse process there. Now, what's interesting is you see these muscles, one coming up to the front, and that's the psoas, one coming into the back, and you can see the same thing happening down here. And so basically, these muscles are balancing each other like guy wires holding up a sailboat mast. And we can see the same thing on our diagram off to the right. That's what those muscles would look like, and that's where they would go. And that's really critical. Because at the end of the day, if one is weak or in spasm, we're going to have different things happen to the spine. If we've got the back muscle in spasm and pulling too much, that's going to reduce the back and neck curve and lead to more pressure on the discs. If it's the other direction and you have the front muscle doing too much and pulling too much, you're going to increase that curve and put more pressure on the facet joints. So if you have too little curve, you want to strengthen the psoas or see if there's a pinched nerve that might be making it weak. You can also get rid of spasm in the quadratus lumborum through all of the different types of treatments listed there. If you go the other direction, you may want to strengthen the quadratus lumborum or get rid of spasm in the psoas. So to learn more about how all of this works and the different types of treatments that might help, go to regenix.com and you can get more information about how to balance these muscles and what types of treatments might help you get rid of this kind of pain. Thanks so much for listening and have a great day.